cigarettes. Take your cigarettes and throw them away. There are no redeeming qualities for cigarette smoking. Everything possible that it can do, it does to hurt you. So whatever you can possibly do, if any of you smoke, number one, smoke fewer cigarettes. And number two, smoke fewer than that. And number three, get rid of your cigarettes. Anything you can do to get rid of your cigarettes, get rid of your cigarettes. Anybody who you love, get rid of their cigarettes. Has anybody kissed somebody who smokes?
You said what? You said kiss somebody who smokes?
Has anybody kissed somebody who smokes? Do you like that? No. Has anybody smelled the breath of somebody who smokes?
Yes.
Anybody ever walk in the house of somebody who smokes heavily?
Yes.
Leave out.
It smells like it. It smells just like it. It be in your clothes and your hair.
It's on your clothes, on your hair, everywhere. And that gets into your body. So, other things in the diet.
No salt.
I'm not saying no salt. I'm just saying if you're using a ton of salt, use less. If you're using a moderate amount of salt, use a little bit less than that. The less salt, the better, because salt drives high blood pressure. Eating more fish, eating more vegetables and fruit, and exercising regularly, all of these things improve the linings of those arteries, making the risk of heart attack less over time. The highest salt content is in fast food, so keep that in mind. Now, when people actually are found to have heart problems, there are treatments that can make a difference. For example, the use of aspirin in higher risk people who've already had heart problems especially, or the people who have high cholesterol levels when diet and exercise alone can't lower it enough, then medication is warranted to help those patients reduce their risk. And blood pressure treatment. The first form of treatment for blood pressure is reduction of salt in the diet. The second is to reduce body weight. Lower weight results in general in lower blood pressure. And here's a little thing to remember. If a person carries a lot of weight and goes to their doctor and their blood pressure is elevated, about roughly 10 to 12 pound weight loss is equivalent to one medication for blood pressure. So one of the ways that people can take fewer medicines is to lose weight. What's the most important aspect of weight loss? Portion control. Eating smaller amounts of food. That is what makes the biggest difference in terms of weight reduction. Now, here's another deal. Here's another deal. Success in prevention. Why is that family up there? The answer is, if any of you have had a family member or friend with a heart problem, you realize that if this gentleman is the one who had the heart problem, the success that he has in reducing the risk in the future depends upon how supportive that family is. The family unit is critical in success in reduction of future risk for heart attack. There's nothing that's more important than a family that supports you. If you are trying to smoke and everybody is trying to stop smoking and everybody in your house smokes, well, the chances are very low that you're going to be successful. If you've had a heart attack and everybody in your house is going to always eat the wrong foods, you are in big trouble because no one's trying to help you.
Do Cheerios actually help your cholesterol?
Oh, good question. Do Cheerios help your cholesterol? Actually, Cheerios contains what's called soluble fiber. Fiber is in vegetables, in certain grains, in fruit. It causes a feeling of fullness, and actually soluble fiber, as in oats, various whole grains, actually can have mild cholesterol lowering effects, about 4 or 5%. Not dramatic, but it does help. So eating Cheerios with 1% skim milk, maybe a little fruit on it for breakfast, is a tremendously better breakfast than eating eggs and bacon and cheese. And, I mean, eggs and bacon and cheese have a loud taste and taste good.
Yes.
But they do taste good, which is why I'm telling you that doesn't mean you can't ever eat it. Just don't eat it every day. Make better decisions.
So if you put sugar on Cheerios, is that defeating the purpose? I do that too.
No, if you put sugar on Cheerios, you got to feed the purpose. Let me tell you, any day of the week, I'd sooner you'd have some Cheerios, a little sugar on it, maybe a little fruit. Any day of the week than eating eggs and cheese and hash browns and bacon, etc., etc. So the answer is the other stuff tastes good, and have it sometimes. Just don't do it every day. Okay? All right. Now, so remember the importance of the family unit. Remember I talked about in medicine, can you feel it when other people are in pain? Well, when people go through something like a heart attack, that is an extremely painful situation. You say, am I going to live? What are they going to do to me? Am I going to have to take medicine? Am I going to be able to work? Am I going to be able to make love to my partner? Am I going to be able to do all the things that I want to do? Okay? You don't know when you're in this situation. And what is so key is to have that support. Remember, if someone in your family suffers something like this, give them the support that's necessary. Help them. If you have to eat some of the foods that they eat, do it, because it's going to help them over time. It's being unselfish. That's one of the first steps to being a good doctor. Okay. Medical follow-up. Why is that important? Sometimes I have patients who I've seen who had a heart attack or needed a stent or had a problem. We get them going on treatments. Their numbers are perfect. Their blood pressure is perfect. Their cholesterol is perfect. They have no symptoms. And then all of a sudden I don't see them for another 18 months. And then they show up. And I say, where were you? And they say, I was feeling great. Well, the answer is, first of all, you need monitoring if you're on medical treatment. You need for the doctor to see you. Another reason is, sometimes we know things earlier on that people don't realize are signs of problems getting ready to happen. But a third and major reason, I always tell my patients, I like to see my patients twice a year for this. Once they're stable, I like to see them twice a year. Why? Because I tell them, I know new treatments that are happening all the time, because I'm involved with research. And I teach all the time, and I go to conferences, and I set up conferences, and I'm involved in all these things. And I talk to other people. And if you don't come back for a year and a half and a new treatment occurred 2 days after you left the office, you don't have access to that treatment. So the bottom line is regular follow-up is essential if you really want to keep yourself in the best possible shape.
But can't you call them and tell them that it's a new treatment that you want them to come in, or is it that their responsibility?
Well, it's a good question. Can I just go out and tell them? Well, the answer is I probably take care of about 8,000 patients. So as a result of that, it's difficult for me to, make sure that every single patient who I ever see, gets access to the newest treatments. I mean, I certainly can tell them when they come, but I got 8,000 people. It's like a city I'm taking care of. So the question is, how will they know? The answer is the best way to know is just to regularly stay in touch with you. Now, some people I remember automatically, so I'm going to call this person, but there's some I don't remember automatically. So the answer is keep in touch with your doctor if you have a chronic medical condition like this, because you won't have access to new treatments as you do. Well, so now I'm going to tell you a little bit about what gets you turned on. And I can tell you what gets me turned on. What gets me turned on in my professional career is to diagnose a difficult problem, to find out what's wrong with somebody who's suffering in one way or another, to treat that and make them feel better. More importantly, to prevent it in the first place. And at university hospitals, we're kind of our mandate over there is to heal, to teach, and discover. Those are the things that that make me happy every day. And I'm an old guy, and I still love doing this. Okay, so imagine the opportunity that you have to be enjoying the opportunity to do that for many years. It's really a lot of fun. So now, what I'm going to ask you to do. Any of you ever seen a professional golfer hit a ball? Anybody? Anybody seen a professional golfer? What do they do? What do they do at the beginning?
Talk stuff.
What's the first thing that they do? They're getting ready to drive the ball. What's the first thing they do?
Put it on the tee.
Actually,
talk to their caddy.
They put the ball in the tee, and then what do?
Visualize.
Talk to their caddy.
Visualize. Yep. Here's what they do. They put the ball in the tee, The ball's down on the tee, and then they go over here, and you see them stand like this. And then they go up and they get ready to, right? They all do that. They're visualizing a drive going 350 yards straight as an arrow down the fairway. Okay? That's the first part of what they do and why they're successful. You watch it. I don't care who it is you watch. Every one of those pro golf, you just turn on a TV channel sometime this weekend, and even if you hate golf, just watch what they do before they drive the ball. Okay? I want you to visualize yourself doing something like what we talked about today. Imagine yourself looking down the fairway and you're saying, there's somebody down there suffering. I want to prevent that from happening. There's something I can do. Or I can't wait. This person has a tumor. I can't wait to help. Maybe I'll cut that out and maybe they'll be better. There's stuff that you can do that can make a huge difference. Visualize yourself in that picture. Number 2, study hard and study smart. I'll tell you something very interesting. When I was in college, I remember when I was early on in my college career, I was working hard and I was studying long hours. I wasn't quite doing as well as I wanted to do. And so I went and I spoke to somebody. I said, you know what? I really think I get this stuff. I just don't feel like I'm doing quite as well as I should. And he gave me certain techniques. He said, you know what? For example, he says you should study in 50-minute segments, 50-minute segments. He said, if you study longer than that, your mind starts to wander. And then you're just kind of wasting time. And they've done studies on this. They show that when you go longer than 50 minutes on one subject, your ability to retain just goes off the edge of the cliff. Okay? So he always told me, he says, once you get to that point, stop, take a break, go out and throw a ball, do something with your friends, take 15, 20 minutes, then go back and study a different subject. And so each time I came back, I was refreshed. I was ready to do something different. And after that, it was like I aced everything because I felt like I was much more efficient. So the bottom line is, it's not just studying hard, but studying smart. Okay? It's not necessarily the time you put in, it's the efficiency of the time you put in. Now, think about somebody who's a role model. Any of you have a role model in medicine? Anybody? Anybody think about somebody they know who's a role model, somebody who they think is really an amazing person? Anybody? Anybody who you know?
Oh, no.
Anybody? And your doctor? What is it about your doctor that's special?
He socializes you, like you want to know how you're doing, what you're doing, like you want to know what's wrong, like you try to do something.
Okay, he really wants to know what's going on with you. He tries to be your friend. Why? Because friends care about other people. I'm not afraid to tell my patients I care about them. You know why? Because I do. I'm not afraid to let my patients know, you know what? I feel so badly today because I know that we have the potential to help you, but you're not helping yourself. I'm not blaming you. I'm just feeling badly because I care about you. Okay? So that's a wonderful thing. That's a great role model. Think about the things that have worked for your role models. Now, I don't know anybody who hasn't had obstacles in their life. Anybody in this room ever have an obstacle in their life? Yeah, practically everybody in this room can raise their hand. You've had obstacles, haven't you? Well, I'm going to tell you in a minute about some of the obstacles I had to go through to get where I am, because you know what? I had some pretty tough obstacles too. Is it?
You're fine.
I had some pretty tough obstacles too, so we'll talk about that. Find a good mentor. Somebody who you can learn from. If you're excited about what you do, or if you're excited about this, go get hooked up with somebody who does this. Watch what they do. Spend a little time with them. See what they do. Find out if it's for you. And boy, this is the most important one. Persist even in tough times. Persistence is what makes success. There are times when you're not going to be doing well, and unless you persist, you will not be where you want to be. Now I'm going to talk to you about every pathway known to man that helps in the metabolism of cholesterol. You might confront something that looks like this. And you look at this and you say, oh my God, I have to throw up, okay? The answer is, I teach doctors about this.
What is this?
This happens to be the entire pathway whereby food is used in the body and where the body gets the things that it needs, and it's eliminated after it's used up. The transport proteins are eliminated, and everything's fine. The reason I show you this is because sometimes, especially when you start a new course, you see